Many of you know that the Affordable Care Act was passed by U.S. Congress in 2010, mandating preventative insurance coverage for mammography screening for women over 40 with no copay or deductible fees. That means that women can get mammograms basically for free. It's the law. According to the Department of Health and Human Services, because of the Affordable Care Act, an estimated 48.5 million women have benefited from preventative services coverages with no out-of-pocket costs. Also, the Affordable Care Act prohibits insurers from denying coverage because of pre-existing conditions. Prior to this Affordable Care Act provision, women could have been denied coverage for pre-existing conditions like breast cancer. Women now have guaranteed access to health coverage, regardless of their health status. Statistically, 1 out of 8 women will develop breast cancer in their lifetime. Mammograms save lives.
This is my fight song. Take back my life song. Prove I'm alright song. My power's turned on. Starting right now. I'll be strong. I'll play my fight song. And I don't really care if nobody else believes. 'Cause I've still got a lot of fight left in me.
I'm Heather Savage, and I'm a scrub nurse in the operating room at the University of Virginia, and this is my office. One of the specialty fields that I work in is breast reconstruction following breast cancer. My patients are survivors. By the time I see them, they've completed their necessary treatments, some with complete mastectomies, some that have had radiation, some after chemotherapy, and I get the privilege of helping them become whole again. The question that I sought to answer is this: has the change in the law requiring insurance companies to cover 100% of this important exam caused an increase in the number of breast cancer screenings, which in turn has resulted in an increase in early detection of breast cancer? Because let's face it, we've all heard the mantra, early detection saves lives. I spoke at length with a plastic surgeon about his feelings regarding the subject. He believed that better diagnostics and greater awareness of screenings has definitely had an impact on early detection. We've been seeing younger and younger patients come into the operating room that have had breast cancer. I set out to find what research has been completed about this topic, and here's what I found. When surveying nearly 3,000 low-income women in the United States between 2010 and 2012, researchers found that insured women have high rates of preventative screening tests, which obviously leads to better outcomes when dealing with life-threatening conditions such as cancer. Nearly 20% of women between the ages of 18 to 64 lack health care coverage. Minority women overall have a higher uninsured rate and also have lower rates of employer-sponsored insurance coverage in comparison to Caucasian women. Also, insured women, specifically those with lower income, are faced with burdens with regard to access to health care, things like affordability, provider availability, and unstable coverage. This finding speaks volumes to the fact that cancer patients of lower socioeconomic status experience a unique hardship that affects not only their quality of life, but also their survival. No woman should die because they can't afford the cost of a mammogram. Many women may not be aware that the Affordable Care Act requires insurance companies to cover 100% of a preventative exam, so spread the word. If you haven't had your mammogram this year, please schedule it today. I'm sure that I would love to meet you one day, just not in my OR.